Hello, everyone. Welcome to the Premed Experience. I'm so happy you could attend the event live with us. Most of you probably know me from Instagram or TikTok, but if I will link all that info in the comments. I try to post helpful stuff for pre-meds and tips from a medical student perspective. So definitely check me out. It's at White Coats and Corgis if that's something of interest to you. And yeah, I'm so happy this event is finally here. I've been working on this for almost 6 months now, and I can't wait for you all to meet the amazing presenters I've gathered here for us today. For me, the goal of this event was to increase accessibility to experts who can help you get into medical school and eventually reach your goal of becoming a doctor. So we have some incredibly knowledgeable experts speaking today, from MCAT tutors to admissions committee members to even medical school deans. So please take advantage of their wisdom and their advice. So I know a lot of you mentioned you were interested in medical experiences abroad, and today we are going to get to virtually participate in one of these experiences. And I'm so happy to announce our next speaker, Dr. Sheetal Vora from Global Medical Brigades.
So we are actually going straight into Tegucigalpa at our urban clinic here in our urban clinic there in Tegucigalpa. And we have some great team members to be able to show you what a virtual patient interaction looks like. So not only do we have in-person programs, but we also have some virtual programs, but you as a volunteer are able to participate in this capacity as well. And so I'm going to introduce 3 of our team members. We have Madison Schweitzer, who is a part of Global Medical Brigades and has the opportunity to be in person in Honduras, which is really exciting. And then we have Dr. Ana, which is one of our doctors in our urban clinics. And what's really exciting is, they are seeing patients year-round. They're seeing patients all over the map, children, women, men, etc. And then we also have Dr. Ibelis there, and she's going to give a little wave. And Dr. Ibelis also is a large part of our urban clinic and has a lot of interesting opportunities in terms of talking a little bit about what volunteers can experience. So thank you all for zooming in here.
Thank you. Good afternoon, everyone. I hope you're staying and enjoying this opportunity to share with us. Okay, I hope this can let me hear clearly. Is that right? Good. Thank you. Today we are going to show you how we develop the telebrigades inside of the clinic with the patients. Okay, and what kind of stuff and supplies we use inside. Okay. For us, today is a difficult day because the schedule is not for the opportunity to get a real patient and right now. But the reason we are going to use the Dr. Ibelis live model for dengue cases disease, okay? Because we are going to try to develop a real cases inside of the urban clinic, okay? For all of you, we let the opportunity to let the chat box open because during the telebrigade, you can make comments, questions, you can ask about the treatment, the medicine, what we do this, what we send this kind of exam, what the patient look like that. And also because let the opportunity to see the real patient, and that way you can collaborate with us in some thing you can I don't know, give more ideas about it, okay? But the reason all the time we let the opportunity to you to interact with us and even with the patient. The patients love to hear you, and that is good because when we are with the patient asks about you, what age are you crossing right now, and the patients collaborate a little bit more when you are staying in front, okay? We respect all the rights of the patients, but the reason we give some do's and don'ts during the brigades, every patient, every student need to stay on the cameras and microphones off and just going to open when you're going to participate with us. For the part of the patient need to send a consent form. The consent form is to give us the permission to can share the medical consulting with you, okay? And this is for prevent to the patients and not share the information in the internet, okay? And also we have a one page, the physical form of the patient, but also we use another one, the electronic, because we are connect with every place where we work is working with Global Brigade, going to see the patient in the real time, okay? Now I'm going to share the virtual medical form. I don't know if you can see right now. Yes, we can see.
Yep, we can see it.
Okay, good. This is similar to the real one. And at least in this moment, the only difference is because we have this apart. It's just because it's a virtual telebrigade, okay? And the normal no has this information, but this is the same thing, okay? Going to collect the personal history of the patients, going to collect the symptoms and signs from the triage, and then we are going to have a little bit history about the disease and what is happened with the patient. Then we are going to have the diagnosis part. We use the International Code Disease Review number 10. That means that all the diagnosis is going to be similar than you know it in the United States, all right? And also the treatment. The medical treatment going to have a code too, okay? But this is an internal code. It belongs to the Honduras because the international is so longer. It's more than 45 letters and numbers. It's so hard to can remember, okay? Then we are going to have a paragraph for can write a different pharmaceutical treatment or some indication for the patient. And then we are going to have OBGYN. In his cases, it's because she is a woman, okay? But if it's a man, we are going to have a man room, okay? Also, we are going to have a page for the optometrist and another word for dental. Okay, now I'm going to let the opportunity to Dr. Ibelis continue with another part.
Great. And before Dr. Ibelis, you start your part of the presentation, I just want to also pause by talking a little bit about what was just shown in terms of our form, right? As we talked about earlier, we actually digitize everything because that then becomes the patient file. And in terms of when we talk about sustainability in international healthcare, when it talks about actually addressing the needs of the patients, not at that given time, but over time, it's incredibly important to be able to look at the patient's chart and then see, okay, they came in, a few months ago with this particular issue. Here's the medication that was provided. Here's the prescription that they filled. This is how they felt afterwards. Be able to, very similar to here in the States, we're able to have a running, ongoing understanding of that particular patient, right? And so when they do come back to the urban clinic, if they need to, we have a running log of what's going on. So, it's really important that I think that's really taking leaps and bounds of what we're doing as an organization as compared to, international healthcare in general, is to be able to have, everything in one particular place and utilizing the internet and utilizing technology to our best advantage. So thank you for showing that. And I think it's really exciting for those of you that are, interested in the tech side of things, in addition to the pre-med side of things, that these are things that we're doing on an ongoing basis. And feel free to ask questions on the chat. I'll be monitoring this, or I would love to hear from any of you of what you think about this process so far in terms of our forms and things like that from an international healthcare side.
Okay. Yeah. Okay, we are going to start. Okay, I'm going to share first the medical form because, like I saying, we are going to fill in a real time during we are with the patients. In his cases, we did sign the consent form and fill the physical form. And right now, if you can see, the patient has a virtual form. Okay, she is visited to us today for first time of this year. And we are open it, and we are going to start to take some vitals. Okay, we took the patient history. Okay, by the way, during the brigade, you do these questions. Okay, you ask to the patient about the personal history in Spanish, family history in Spanish, current medication, and medication allergies. Okay, some translated and traduced for you because the patient, they say a lot super fast information, and it's sometimes a little bit hard even for us speaking in Spanish. Okay, try to get what the patient is trying to say us. Okay, for example, okay, we are going to start with the patient Ibelis. Buenas tardes, doña Ibelis. Bienvenida. Cuénteme por qué viene el día de hoy.
He presentado fiebre
Fiebre. Fever.
Fiebre, dolor de cuerpo.
Body pain.
Y bastante dolor de cabeza.
A strong headache. ¿Desde hace cuánto presenta sus síntomas?
Y hace 3 días más o menos.
You say you start the symptoms 3 days ago. Okay. ¿Puede contarme qué fue lo que pasó? ¿Cómo pasó eso?
Pues empecé a lo asocio que viajé a San Pedro Sula y a la casa de una amistad, de una amiga, y al lado pues había un solar baldío, había bastantes zancudos también, y pues al regresamos también, ¿verdad? Ya empecé con los síntomas, malestar, sobre todo empezó con la fiebre.
Okay. She say around 1 week ago she visited on vacation a one friend in San Pedro Sula, is the north of the country. Okay, this is an endemic area of dengue fever. And she said she was visiting a one land park, open it, and it has a lot mosquitoes flying away. And she believed maybe that was the reason, because when she returned 2 days ago, it started with a fever, headache, body pain, and photophobia. Okay, that is one condition when the patient don't feel well looking in the light. Okay, the eye feel a little bit burning and dry, and that can increase even the headache. Okay. When we have a headache, it is important to establish what part is started with the headache, okay? That was the reason I'm going to ask about it. ¿Qué parte de la cabeza le duele más cuando le está doliendo la cabeza? Okay. I don't know if you can see. It start in the forehead area. That means it's start to have a little bit inflammation and even the irritations, okay? Another important thing is we need to ask is the patient has another kind of symptoms, maybe she cannot remember. And we need to ask for anything else. ¿Ha presentado vómitos, diarrea, algún otro síntoma? ¿Sangrados?
No, vómitos, no, ni diarrea, lo que es poco apetito, ¿no?
Low appetite.
Tengo mucho deseo de comer y escalofríos sí me da bastante.
A little bit chills.
Y al caminar, sobre todo, sí me duelen las rodillas,
Okay.
los hombros, la espalda.
When you walk, has a strong knee pain and back pain too. Okay. In the personal history, she denied any history. In the family history, the mother and grandma has diabetes. It's not taking any medication right now, just acetaminophen for the fever. And she denied allergies, just has allergy to the pineapple. And that is important because sometimes we just asking about the allergy to medication, but it's necessary to need to have information about another kind of the allergies. Okay, we indeed took the temperature and the fever, and right now I'm going to show you the saturation of the oxygen. And va a poner su dedito acá, por favor, me va a dejar abierto su manito sobre la mesa y vamos a compartir la siguiente pantalla. Okay, now I'm going to start to share the second part of the exam. Right now, you are looking at the saturation of the oxygen. The patient right now is having a 96 of saturation and one pulse of 75. The most important thing we can see right now is about the diagram need to be so similar when one couple for another couple. Okay, the herbidin is almost sustainable. Is because it's between 73 to 74. By the way, the normal levels is between 60 to 100. The books say 80, less or plus 20. That's mean for her is super normal. The saturation of oxygen after we born, we need to have it between 95 to 100 in kids, and after to the 12, 95 to 99 of the saturation of the oxygen. Okay, unless you have a chronic diseases like bronchitis, asthma, or some another condition, for example, the sequel for the COVID disease, The patients can present a little bit low levels of the saturation of oxygen, around to less than 95, but up to 91, and we are going to consider normals, okay? What do you think about it? You can type it right now, and what do you think? Is normal or is low? I don't know.
Great. So go ahead and put in the chat, you know, what you think about her vitals. If you feel that they look really good, if you feel like there may be an issue, and Dr. Anna can also, you know, kind of determine how close you are to the correct sense of from the medical side of things. And also, you know, just to highlight, this is really interesting technology that we're able to share with all of you. You know, obviously this is, you know, a patient who we're simulating, but oftentimes we're able to see live, you're able to see live, you know, if there's changes, and working alongside and communicating with Dr. Anna or any other physician on our team to be able to understand why that might be happening, right? So these are some really interesting areas and aspects of the experience in which you're really getting a true sense of what's happening medically, and not just, you know, numbers, or not just looking at a basic form to understand on a live sense what's going on.
Yes. Okay, now I'm going to proceed to take the blood pressure. Yes, thank you, Melissa. Okay, we use a technical approval for the FDA. Okay, that is important because sometimes you can think we are not going to use the good one equipment, okay, but we are using the more similar to the hospital, even in a small clinic like we have, okay. For taking blood pressure is very important. Let them rest the patient, choose one arm, divide in 3 parts, choose the middle part, and put in the correct way the bandage, okay. For the patient right now, we use a medium bandage like this one, okay. We are going to try to close this one, not so tight, not so loose, okay, because if we let loose, we are going to get a more higher level of blood pressure. If we put it so tight, also we can get more high. We need to explain to the patient what is going to happen, because going to a little bit tight and can produce a little bit pain. The patient can make moves, okay. Va a apretar un poquito, mientras esté apretando un poquito, usted va a estar relajadita, no me cierre la manito porque estamos tomando la presión, no la sangre. Y una vez que termine 10 segundos, la máquina se va a apagar, okay. Okay.
While Dr. Anna is taking the patient's blood pressure, you know, we're getting a lot of questions about, do I need to know Spanish? Do I need to be a Spanish speaker? Do I need to have any sort of requirement? And as Dr. Anna just shook her head, absolutely not. You do not need to have any Spanish requirement at all. I will say you'll be learning a lot of Spanish during this type of interaction and during your participation, especially medical Spanish, which, you know, as you know, is such a critical skill and such a useful and valuable skill to be able to have should you ever, as an aspiring physician or a physician yourself down the line, interact with those that may need some translation support. So we're kind of doing a little bit of a hybrid of English and Spanish, but we would always be having a translator so that you're able to follow along, just like Dr. Anna is doing, and also brush up on your Spanish skills, which is really exciting.
Okay. Okay, today we got with the Dr. Ribelis, 97 under to 65 of blood pressure, okay? What do you think about this blood pressure? You can put good, down, do you say? Good, good, or bad, bad. You can. Try to interact with me, because that is what we are trying to do during the telebrigade, okay? Learn a little bit about medicine or refresh some knowledge. By the way, after to the 12 years old, the patient needs to have over 120 over 80 of blood pressure, okay? That means for Dr. Ribelis or our patients today is super, super normal. The complexity of the patient right now let the opportunity to get this numbers and consider super normal, okay? She has a weight about to 118 pounds and was a measure about to the 1 meter 65 centimeters. Okay, is BMI is 19.7. I need to show this one. Okay. Okay, we almost is finished with the things, okay, and we asked about it. We need to check that all the part of the exam, because if you remember, the patient has a fever, but right now is having a little bit, okay. We start to build that diagnosis, is having headache. We ask about what is the place start with this. The patient developed photophobia. For the reason is going to be good. Check the eyes, okay. Going to be a little bit uncomfortable for the patient, because remember, she's having headache. For the reason, we need to explain all the time what we're going to do with them, okay. And right now I'm going to share with you my, oh, what is not working this? Let me see something. ¿Qué será este? ¿Sí, verdad? Okay, let me check. Sorry.
And while Dr. Anna is taking a look at that, we're also getting a lot of similar questions around having any previous experience, any shadowing experience, any sort of pre-med experience to be able to participate. And similar to the Spanish answer, the answer is no. What we are looking for is anybody that is interested. You don't have to have any experience. You will be gaining that experience and those hours during the time that you'll be on the program. And so please feel free. We'll drop the link in the chat and of how you can get involved and how we can contact you with further information. But yes, no experience is necessary, and we're just looking for really enthusiastic pre-med students to be able to support in that capacity.
Okay. Now we are going to, we are going to share our screen during the exam of the eye. We are going to use our iriscope. This is iriscope, let the opportunity to see the conjunctive of the patients, the eye of the patient. Right now we are seeing the iris. Okay. We have a lot of light in the room. That is the reason we cannot see a clear. Let me check. I'm going to turn off the light because it's not working. Okay. Super good eyes. Okay. By the way, the doctor wears eyeglass. Okay. A little bit dry, so that is happening because it's not was drinking water in the correct time. Okay, but just that things. Okay. A little bit the region is start right now. For me, it's a good eye. Okay. Also, we can use sometimes. We can use another kind of equipment. For example, we can check the ears. And right now I'm doing this because I want to show you what we can do with all the patients during your telebrigade experience, okay? We don't have limits. The only thing we need to know is what is happening with the patient. And we are going to let the opportunity for every patient get a good diagnosis, a good physical exam, a good and equality, good quality experience for the patients. Why? Because in our country, this is a little bit hard to get a one spot in the public health services, and for the reason we need to use the private. And Global Brigade will let the opportunity to give this one on digital otoscope, right? Okay. Okay. Yes, sir. No. Sorry. I guess it. No. Tendría que estar en el 4. Oh. Sorry. Okay. Let me check. Sorry. Okay. We are going to see directly the middle ear with these things. Right now we're trying to see inside. This is the conductor 2. Okay. The tympanic membrane is almost in from here. Okay. A little bit serum.
The doctor is having a little bit allergy, by the way, right now, and that is the reason you're going to see the structures look a little bit redness, okay, almost. Maybe the people can think it's a little bit bleeding, but now this is a part of the allergy inflammation, okay. And for another ear, we are going to have the same, almost the same condition, okay. Okay, this ear is not looking well, doctor. Okay, a little bit. It's a little bit part of the rhinitis and of the allergy things. Okay. For me, this is a 1 year with allergy. Okay. Sorry.
So as Dr. Anna said, it looks like, one ear is looking pretty healthy, or at least healthier. Another ear is looking pretty irritated, mostly due to potentially from allergies. There was a question that came up in the chat about, us testing. Do we test patients for allergies and be able to treat them? Dr. Anna, would you like to answer that question?
Yes. We are not specifically can do this exam here, like in the clinic, but we make some alliance with another kind of group. And in these cases, we are working right now with Analyza for the chemistry exam and the blood test exam. Right now, in fact, we are having an X-ray machine. That is the reason we can make one part of the exam for give the definitely diagnosis, because remember, we can have a presumptive diagnosis, but we need to confirm with another kind of exam. In fact, around two months ago, we start even use an ultrasonogram machine for establish another kind of the diagnosis. That means if you ask me, I can make a sun exam for make an allergy panel or something like that. No, here we don't have that kind of machine and even the laboratory test exam, but we work together with another group. In this case, we are going to send another kind of organization, but this is organization make an alliance with us, and they say, okay, I'm going to offer my services for a low cost, and that way we can help more people in Honduras. Okay, we are trying to make these bonds with a group, and the group has the same idea for us. Okay, okay. After to this, we finish with the physical exam. Okay, we check the eyes, we check the ears, we check the tonsils, and the patient established we have a presumptive diagnosis. Okay, our presumptive diagnosis is she traveling with one endemic zone, maybe it's dengue. I need to do or send some exams. Okay, I'm going to explain to the patient she needs to take the blood test exam and confirm. Okay, for COVID exam. For example, for Helicobacter pylori disease, for example, for pregnancy, for urinary test exam, for quick exam, we have all the kind of exam inside our clinic. Okay, for the rapid test exam, we have the kind of exam. Okay, for a little bit more specific, in his cases, dengue, we need to send another center. Okay, but if we have influence, or we are suspecting about to the COVID disease or urinary tract infection, we have that kind of rapid test exam inside of the clinic. Okay, we are going to send one exam for count the platelets, white blood cell, red blood cell, and the patient needs to return with us for a follow-up of consulting. Okay, we are going to establish one diagnosis. We are going to collect in the page of the patient. In his cases, it's going to be important at the suspicious about to dengue. Like the symptom of the patient is fever, we can type fever, okay, like diagnosis, but also we can type here dengue disease, okay? Why? Because we are suspecting. This is unspecific because we don't have the definite diagnosis, and it's necessary to collect all this information here because it's the patient return in the afternoon or the next day, we can follow the evolution of the patient. The symptoms, the treatment we can provide to the patient is going to be for the symptoms, okay? And that way we are going to recommend acetaminophen, for example. We are going to recommend 12 right now because we are going to put 4 times per day every doses. It is important to recognize if the patient has is taking another kind of medication for the interaction of the medication, for the side effects. We explain to the patients all the time. And during this moment we are explaining this, we are going to, you're going to have a wanna translate patient, make it all the translation, or even if you have question, we can solve right now. Okay.
And that was a great point that you made, Dr. Inez. If you had questions, typically during the virtual session, there was a question that came in that says, are we just observing doctors on a virtual brigade? Observation is a large part. Observing doctors and shadowing from a virtual standpoint is such a large part of this experience, but there's a lot of interaction that you would be having with the doctor. So Dr. Anna, in this case, would be asking questions to all of you as what do you see in terms of the tympanic membrane? What do you see in terms of the dryness of the eye? What do you think that would be? There's a lot of interaction when it comes to that, to understand the diagnosis, to allow you to kind of take a stab at that, to understand concepts like differential diagnosis, that they're presenting with this particular thing, but what are some of the other potential issues that may be there that are not, that are not so obvious or typical. There's a lot of pharmacology that you'll be learning in terms of what does this medication do. So there is observation, but there's a lot of interaction. Now for today's standpoint, we were able to do a little bit of it, but typically on an actual program, there's a lot of back and forth, and there's an opportunity to collaborate, to support in terms of understanding where the patient is coming from a healthcare standpoint, and then also just a lot of critical thinking activities that are being done in the actual workshop.
Okay. Then we send the patient for the next station. In his cases, the patient needs to visit the pharmacy station. We have a pharmacy inside of the clinic with a super cheap cost of low cost of the medications. And if the patient needs to another kind of evaluation, we send them for another part. Okay. If this patient in another case was on needs or some X-ray or something like that, we send them immediately for that stations. Okay. And then the patient is going to receive one appointment for give the follow-up of the patient. Sometimes even you are super interested about the cases, we can send them the information, evolution of the patients with your PAs, and you can follow the evolution of every patient. Also, remember you right now is just watching a medical consultant, but sometimes you can participate in the pharmacies brigades and pharmacy chats too, or reunion with the dental, with another kind. Even we are thinking right now start to put it in to work the X-ray and even ultrasonogram sessions, and that way you can share with us all this part of the medical consulting with the patients. Okay. I don't know. I am.
Great. Well, thank you so much, Dr. Anna and Dr. Vélez for simulating a patient interaction. I think that for those of you that have watched this or will be watching this, I hope you can kind of see that using technology, using the interaction via Zoom to be able to truly see a patient interaction, a patient consultation, the diagnosis, right? What would be prescribed, the whole process. And, so again, one last thing to note again from Dr. Anna's conversation here with all of us is that, we have partnerships in country to be able to support if we're unable to do certain things in that particular setting. So for example, this particular patient had the diagnosis is possibly dengue fever, which is a very common issue in Honduras and in Central America in general. It's a mosquito-borne illness that creates a variety of different issues within the patient. And so from there, we would send her to a laboratory to get the official dengue test, receive the results, and then be able to provide any additional treatment from the clinic if necessary. And, our urban clinics are also, just there. They're very, very seeked out because we also have the most affordable medication in the capital to be able to have more healthcare equity within the region. So I hope that everyone was able to really kind of see a little bit of what the patient consultation interaction looks like. And then I'm going to pass it over to Madison to talk about, there's so many questions about how can I get involved? What do I need to do? Do I need experience? All of these things Madison's going to talk about so that we can get you in Honduras, either in person or virtually.
Yeah, 100%. Thanks, Sheetal. As mentioned, I'm Madison. I work for Global Brigades based out of Richmond, Virginia, but this past week I have been in Honduras. It's been awesome. So great to see all of these projects on the ground and see the impact in real time. And so I'm so excited to get to share with you guys a little bit more about how you can get involved. So all of our programs are run through universities, which is really cool because you're going to also get to network with a whole team of pre-med students at your school. And you're also joining a larger network of thousands and thousands of pre-med students, med students, alumni that are practicing physicians as a part of our organization. So the first step I would recommend to getting involved would be seeing if there's a chapter already active at your school. If not, honestly, that could also be great news because it's an excellent leadership opportunity. We have a scholarship available for the student that starts a chapter at their school. And you also have the power to create something that's going to be active and creating impact at your school and in our communities for years to come. So we have a QR code here that you can scan to fill out a quick form. We'll also drop my meeting link in the chat if you just want to sign up for a meeting to chat next week and jump right into it. I'd love to work with you to figure out how we can get you on a medical, dental, or public health brigade. I mean, as soon as this summer, we'd love to have you here. So moving on to the next slide. I also just wanted to highlight a couple new cool things that we have as a part of our brigades. So we're always looking at feedback from students when they come back from a brigade. You know, what are they telling us? And something that we have heard a ton is that students want more time in country, which is awesome, of course. Music to our ears, and we want to make that happen for you. So we have a couple ways you can do that. We're offering add-on days. So if you are looking at just a week in Honduras and you're like, you know what, I want to spend a couple more days. I want to learn more about the country. Maybe I want to learn more about another program. We now have that option for you. So you can expand your brigade beyond just a week. We're also launching a lot of really exciting research projects. So we have a super robust monitoring and evaluation team that's keeping track, as Sheetal mentioned, of all of our patients that are coming in. And that leaves us with a ton of data and a ton of potential for research for how we can continue to expand these projects. So you can join us and support our research. We've also had students come in that gather data on our brigade to support independent research. So whatever you're looking for, whatever you're passionate about, we want to work with you to make this an experience that will really connect with your goals as a future physician. And so this can be coordinated directly with us or with your chapter at your school. And then lastly, I know we're throwing a lot of exciting opportunities at you, but I just wanted to mention one more, which is our immersion program this summer in Ghana. So this program is a little bit different from our typical brigades because instead of just being in a rural setting, you're going to be shadowing doctors in 2 urban hospitals as well as 1 urban clinic or 1 rural clinic. So you're going to get to work with a lot of different doctors. You're going to get to see some more intensive procedures, you know, that of course can only happen in a hospital as compared to a rural clinic. So you're going to get to see a variety of different doctors. You're going to get over 40 clinical hours. You're going to be shadowing in several different specialties and also seeing several different settings. This is a 12-day program, so it's really packed. We're going to make the most of your time there. And of course, you're also going to get to see some of the fun things that, you know, Ghana has to offer. You know, they're traveling to a new place and want to enjoy the experience as well. So we have a QR code there as well. You can join on the website and we'll follow up with more information. But just thanks for joining today. I mean, I am so impressed and thrilled that we have hundreds of people here today. It's really exciting, you know, that there are this many students that on a Saturday are willing to take some time to learn about ways that they can give back, learn how they can be a more impactful physician in the future. So just thank you for taking the time, and I'm really excited to hopefully talk to some of you guys soon.